Carnosic acid might not have the household recognition of curcumin or resveratrol, but in the neuroscience world, it's quickly climbing the ranks as one of the most promising natural compounds for fighting cognitive decline. Found primarily in rosemary and sage, this diterpene phenol has shown a stunning range of neuroprotective effects, from quenching oxidative stress to supporting synaptic integrity. But what's really turning heads lately is the way researchers are stabilizing and synthesizing carnosic acid derivatives to push it beyond supplement shelves and into serious drug development pipelines for neurodegenerative diseases like Alzheimer's. At the heart of carnosic acid's power is its mechanism of action, which is elegant and unusually targeted. Carnosic acid operates as a proelectrophilic compound, meaning it doesn't activate until it senses trouble, namely oxidative stress. When brain cells are under attack from free radicals, think aging, inflammation, or amyloid toxicity, carnosic acid transforms into a reactive electrophile that activates the NRF2 pathway, a master regulator of the body's own antioxidant defense system. This is not your average antioxidant that just floats around neutralizing random reactive oxygen species. This is targeted biochemical warfare. By activating NRF2, carnosic acid triggers a cascade of protective enzymes like glutathione peroxidase, heme oxygenase 1, and superoxide dismutase, equipping brain cells with a localized and robust defense system. Unlike synthetic antioxidants, which can backfire by disrupting redox balance, carnosic acid only steps into action when and where it's needed, making it both powerful and self-regulating. In animal studies, carnosic acid has shown the ability to reduce amyloid plaque formation, preserve mitochondrial function, and enhance synaptic density, especially in regions like the hippocampus, which is crucial for memory. Some studies have even reported reversal of cognitive deficits in Alzheimer's models after administration of carnosic acid-enriched extracts. That's not just slowing the disease, that's recovery of function, at least in rodents. But here's the catch: carnosic acid, in its natural form, is chemically unstable. It oxidizes easily, especially in the presence of light, heat, or oxygen. Hardly ideal conditions for pharmaceutical use. That's where the synthetic versions come in. Researchers have been working on semi-synthetic analogs and stabilized formulations of carnosic acid that retain its NRF2 activating properties, but offer better shelf life, brain penetration, and bioavailability. Some of these derivatives are even designed to cross the blood-brain barrier more efficiently, a major challenge in neuropharmacology. One such derivative, known only by a preclinical code name for now, has already shown efficacy in mouse models of Alzheimer's, traumatic brain injury, and Parkinson's disease. It mimics carnosic acid's ability to activate protective gene expression, but in a more predictable, drug-like fashion. Early data suggest that it may reduce tau phosphorylation, the toxic process behind neurofibrillary tangles, and improve behavioral performance in memory tasks, without the toxicity risks that have plagued other synthetic NRF2 activators. Unlike some one-trick pharmaceutical ponies, carnosic acid works pleiotropically. It affects multiple interconnected systems in the brain, but it does so in a way that's adaptive rather than disruptive. This may be key to avoiding the side effects and limited efficacy that have plagued previous Alzheimer's drug trials. Of course, we're not quite there yet. As of now, most carnosic acid research is preclinical, and the stabilized versions haven't reached phase 3 trials. But the momentum is building. A few nutraceutical companies have already begun producing carnosic acid-enriched extracts with enhanced ability for cognitive support products, though these are far less potent than what's being studied pharmaceutically. Still, the big idea remains. What if the next major leap in Alzheimer's therapy comes not from a lab full of synthetics, but from a compound nestled in your spice rack, refined, stabilized, and optimized for the task of neuroprotection? If successful, carnosic acid could mark a new era of plant-derived cognitive therapeutics, ones that don't merely mask symptoms, but intervene upstream at the cellular stress response level before the brain's architecture begins to crumble. So next time you sprinkle rosemary on your meal, take a moment. You might be seasoning with the molecular blueprint for tomorrow's brain health revolution.